Okay, so we are live. Father Michael, I don't know if you know this, but last week was our first episode, and I launched the broadcast on my personal Facebook page and then found out when the episode was over and then uploaded it to the Antiochian Facebook page later. So I am really praying that I set this up correctly this time. And yeah, so it should be on there. But obviously there's a small chance that I made this same mistake again. So I'm monitoring the Antiochian Facebook page on the side in my alternate screen, and I can accept messages. So we'll see if we got everything set up correctly. So this is our second episode. Father Michael, I'm glad you're on here. For those who are new viewers, basically what we're looking at is a short episode that's kind of condensed on some important information that has been tested related to parishes, either in renewal, revitalization, or just something that's working. But it's always been tested. We've always known that in this scenario it worked, and then we share that information. And so that's basically so today we have Father Michael Habib. Do you mind introducing yourself a little bit?
Sure. Yeah. Thank you, Deacon, for the opportunity to be here. So I'm Father Michael Habib. I'm the pastor of St. Ignatius Orthodox Church in Twin Falls, and I'm also the dean of the Pacific Northwest Deanery for the Antiochian Archdiocese. I've been in the church my whole life, and I'm very excited to talk about this program that's the topic of our discussion today.
Yeah. So you got me signed up a year or two ago. I can't remember exactly when. Mm-hmm. And hopefully that helped you out. We'll explain how it can help someone out and why we're it's not normal that you sign up for insurance and it helps someone else out. So true. That's rather good. So I'm confirming now. I'm checking on the Antiochian page. Looks like we are live. So that's good news. So basically the topic is, and we don't have to go into detail about this, but there is a lot of concern about the current state of clergy health insurance. The current premium offered through, and this is a joint effort, you probably know more about it, through multiple jurisdictions, and it runs about $2,500 a month. Mm-hmm. I don't know how many of our parishioners understand how difficult that is, or what a burden that can be on a parish to spend $2,500 a month plus a deductible. And the Archdiocese, in their defense, has worked very hard to try to provide for our clergy. So, this is not something where we're trying to accuse the Archdiocese of failing or doing a bad job. That's not what we're talking about. I mean, this health insurance is a topic for the entire country. So I don't want to come across as that way. But we are so thankful that we have an alternative, and it's an alternative that not a lot of people know about. And so that's why, Father Michael, you're on here today to talk about an alternative, and you're going to talk about one particular alternative called Christian Healthcare Ministries. There's other companies doing similar things, but this is the one you're signed up with. And so if you could kind of introduce how you found out about it and what it's like using it, and then we can go into some details of how different it is, because it is different.
Yes, indeed. Thank you. Yeah. So the interesting part was my introduction to Christian Healthcare Ministries actually came about by multiple events that all kind of coincided at the same time. The first event was I was about to get married. We were engaged, and I wanted to make sure my wife had proper health coverage from day one. The second thing that happened about that same time, I had to go to the emergency room. It turned out to be nothing serious, but the symptoms were something more serious. And so my medical friends recommended I go get checked out. And I ended up going twice in about a 3-day period. And when I got the bill at the end, the total charges were about $7,000 for both of them. And the insurance company either deducted or paid for $3,500, leaving me with my portion of $3,500. Which is a lot of money, especially given the fact I was just about to start a new family life and all that. At the same time, the third event that happened was when I was trying to get my wife covered, she was actually denied by at the time, my current insurance provider because of a pre-existing condition. Now, this goes long before the Affordable Care Act was put into place. And so, excuse me. And so basically I was left with the option of keeping my current insurance, which was costing me alone close to $500 a month, and leaving my wife uninsured, or making a change somehow and finding something else. So in my travels, I was introduced to this program from another member of one of the parishes who had just signed up for it and had just gone through, I think it was a hernia surgery or something of that sort, and had gone through the whole process to be able to give a testimony to how the whole thing went. So the gist of how you want me to talk about how it actually works?
Sure, yeah, we could go ahead and
Yeah,
it's quite different.
Yeah, the gist of basically how it works is when there's a medical incident. Now, an incident is defined as anything that's not considered routine. So when you go for your normal physical exam, for example, that's routine, that they don't cover. But anything above and beyond that, pretty much, is when is defined as an incident. And whenever an incident happens, we go in as self-pay. When, the first question they ask you when you check in at any doctor's office is, can we have your insurance card? That's their priority, is getting that insurance card. And the response is, no, I'm self-pay. And then they will end up billing the patient. That's how it works in the medical world. And so what we do is we get the bill as the patient. Now, if it's a small bill, we like under $1,000, we pay it and hand it off to Christian Healthcare to be reimbursed. If it's a larger bill, we can work with Christian Healthcare Ministries on how that payment's going to work out. The key thing is asking for discounts at the doctor's offices and hospitals and such. And they will give discounts, especially if they know they're going to get paid in full for a larger amount in a very short period of time, because a lot of people without insurance don't ever pay their bills. So Christian Healthcare has a whole department that helps negotiate that to get the bill down as low as possible. And they work with the individual patients on those particular bills. And so basically it's taking the insurance company piece out of it altogether. And it's the patient and the doctor making the medical decisions, and the patient and Christian Healthcare working on the reimbursement for that cost. No pre-approvals are necessary. If the doctor decides that a treatment or a hospital stay or whatever is needed and the patient consents to it, as long as it falls within the covered items, then Christian Healthcare will cover it. They do not get involved in medical decisions. In fact, the first thing they tell you is if you need medical care, go and get medical care. Deal with the financial part of it later, which is really a breath of fresh air.
Yeah, it is. Yes, it is.
Yeah. That's the macro level of the way it works.
Yeah, it is. And maybe we should share a little bit about the pricing, because I have found myself going through the whole thing kind of feeling like it's too good to be true.
Sure.
Because of how affordable it is, and what they take care of, and the whole package. And when you're comparing it to other rates that you're looking at, you're like, okay, I feel like I'm missing something. And they do have some peculiar rules that protect them they are a faith-based organization. But if you've ever heard of Samaritan's Purse, you've ever heard of MedShare, it's a group sharing plan, and so their overhead is lower. I read in a recent email from them that they've always paid out. They're not. That's what some people get nervous about, is they're not required to pay out, and they've yet always paid out. I couldn't find a single incident where they had not reimbursed or made that payment.
Yeah.
So that's something important to know.
Insurance companies find ways not to pay stuff all the time.
All the time they get out of stuff. Yeah, where they'll deny a claim.
They're going to look for a reason to not pay for it.
So you've got insurance companies denying claims. Then you've got Christian Healthcare Ministries, who's always paid out.
Yeah.
And you're looking at, if you're married and you've got kids, you're looking at probably the level that I do, and that I think Father Michael, you recommended it, is going to run you about $450 a month. They have lower packages, and I just didn't see the point in going with the lower packages, and I wanted to protect myself. And then I think the biggest thing that was a shocker, do you mind talking about Brothers Keeper? Because that thing is a lifesaver if someone goes in the hospital for a while.
Yeah. So Brothers Keeper is essentially an add-on to the basic Christian Healthcare Ministries package, let's say. So at the gold level that the deacon's talking about, it would be $450 a month for the family. It's $150 a month for the husband, $150 a month for the wife, and $150 a month for the children collectively. That's whether there's one child or 10 children. It's one group. They group them all together. That would cover up to $125,000 per incident of payout. So they have the add-on called the Brothers Keeper, and the Brothers Keeper basically takes that coverage to an unlimited number. So there is no limit to the coverage at that point when you're on the Brothers Keeper. The cost for the Brothers Keeper, in addition to that $450 a month that we had mentioned, is, I have my notes here I'm looking down at. So it's $40 per year administrative fee for the whole family. And then it's anywhere from $2 to about $25 or $30 per quarter per unit to keep the fund up. Essentially what they do is whatever funds are paid out of Brothers Keeper in the previous quarter, they take that number, divide it up by the number of people that are members of Brother Keeper, and that's what we contribute to keep the fund up. So I've seen some quarters where nothing was paid out, so the bill was zero. Some quarters it was 25 or 30 per unit, and again, a maximum of 3 units per family, and so we paid 75. I've never seen the total amount for Brothers Keeper for the family for a year exceed $250, which is absolutely.
I think it's important to point out that you're talking about coverage that's, over $125,000.
That's catastrophic coverage, basically.
This is catastrophic coverage, and no one has ever regretted having catastrophic coverage when they needed it.
Yeah, exactly.
Yeah, so it's for what you're paying, it's definitely worth it. And that $40 is annual.
Correct.
Yeah, correct. So that's not plus the $450 monthly. You've got a $450 annual. Then I think you said it was a quarterly.
Right, it's $40 annually, and then there's a quarterly amount that varies from quarter to quarter. They send out a statement. Your total for this quarter is going to be X amount.
We're roughly looking at a difference of $2,000 a month.
Yes.
Which is incredible, a huge difference, and the burden that $2,500 a month can put on a parish. There's a number of parishes that just can't afford that, but they could afford Christian Healthcare Ministries.
Yeah, absolutely. I mean, I can tell you that $2,000 a month that's being saved. I have priests in my deanery that aren't even paid that amount,
right? At
all. So that's that really is a huge amount of money.
Now, do you mind sharing? There's a couple of peculiar rules that we really don't, I guess, disagree with, but it's important to know going in. You want to know what, and so, like, for example, I think one of the things you warned me about was if you have a daughter and she gets pregnant, can we talk about, so, we encourage people to read all the fine print. So can you share that, what you shared with me is just kind of an example of what you're, signing up for?
Yeah, the key is, I tell everybody this before signing up, online they have a book of guidelines. And the book of guidelines is like their Bible, for lack of better words, as to what gets shared and what is not shared. And they follow that book to the letter of the law. And so I encourage folks before making the change to read that from cover to cover so they know what they're getting themselves into. It's a Christian-based organization. They expect their members to live by biblical principles. And therefore, one of the scenarios they have specifically excluded from coverage is unwedded pregnancies. And so I always make sure that folks know going in, if they have a daughter who happens to have something happen and ends up pregnant before they turn 18, the parents are going to be financially responsible for that entire pregnancy. And they just need to know that going in. We hate talking about that. I have a daughter myself. I hate the idea of thinking about it, but we have to be realistic in how we think. Now, once she turns 18, the parents can say, well, that's her problem, right?
Right.
But until she turns 18, she's the financial responsibility for parents. And so it's something to know going in. Okay, that is one area that dramatically differs from a traditional insurance. Another thing is they will not cover incidents connected with the overconsumption of alcohol or the consumption of tobacco products. So anything that is caused as a result of those are excluded.
So let's say that you were diagnosed with COPD as a result of smoking.
Right. That I mean, you know, there's always that you can make the appeal and see if they're willing to budge a little bit. But yes, exactly. That would then be excluded.
Or if you have liver failure from alcohol or something like that. Yeah.
Exactly. Because that they consider that to not living within the biblical principles, you know, of taking care of the body and so on and so forth.
Right. So, but this emphasizes the point of you need to read the guidelines,
yes.
Understand what's going to be covered. That they're still offering something great. You still run the risk of not being covered with a regular insurance company. You never know what they're going to deny.
Yeah.
And so there's nobody out there that covers everything at all times, no matter what. That doesn't exist.
Yeah.
I think the last thing I'm going to ask you about before we see if we have any questions, will you talk about the referral program? Because I gladly put down your name. Like I said, if I get someone else to sign up on my insurance plan, I say, hey, I'm doing this, you should do it too. They don't, help me out with that. They don't say thank you.
The referral program is my favorite thing to talk about because that's the referral program with Christian Healthcare Ministries is actually simple. If you refer somebody to the ministry and they join and list your number as a referral and stay on the program at least 3 months, the referring member gets a free month. So essentially, after that 3 months is over, the next pay statement that comes out will show, $450 due and or monthly gift $450, and then instead of due, it'll be refer a friend to program minus $450, balance due $0. And then you skip. You're not paying anything that month.
You should have had one from me, I believe.
I did.
Yeah, good.
They don't tell you who it is that you've referred. So I just see refer a friend, and that's it.
Good.
But the nice thing is there's no limit to that. If you can get 12 families a year, and it's by family, it's not by individual, right? If you can get 12 families a year to join, you don't pay anything. You would just pay for Brother's Keeper.
Yeah.
At that point.
Yeah.
I highly recommend Brother's Keeper. I would not go without it. It's so inexpensive.
It's such a peace of mind to know that, you never, and usually it's something that you can't anticipate. A really bad accident that puts you in the hospital for 6 months.
Yeah.
That's going to be an astronomical hospital bill that, the Brother's Keeper is going to take care of.
Yeah. So there's a couple other things, if I can, I wanted to throw in a couple other points as I'm looking down at my notes here. It should be known that it does not include vision or dental insurance. So those two items are not included in any way, except that my understanding is that cataract surgery could possibly be covered. And if you had dental damage done to your teeth in some kind of an accident, then that could possibly be covered. The Book of Guidelines spells that out very specifically, and I don't want to misquote it here. So read that. And the other thing is prescription coverage is a little different as well. I think we should talk about that for a moment. So with prescriptions, only prescriptions that are related to a specific incident are covered under this plan. So for example, you break your leg and you need to have surgery. The doctor prescribes some antibiotics, some pain pills, or those kind of things. Those would be covered because they're intended to deal with a specific incident. But anything that's considered maintenance, where you're no longer receiving treatment, but you just have to continue taking the medication, high blood pressure, high cholesterol, things of that nature are not covered. But it's very, very easy to get all kinds of negotiated prices with the various pharmacies to get those drugs at very inexpensive prices. In fact, Deacon, do you want to say what you told me right before we went live about your experience with that?
With HSA?
No. With the prescription.
Oh yeah, yeah. So I've been researching a bunch of stuff, getting ready for this episode. So, but basically, I was spending about $20 a month for my prescription on our old plan. We were on a ACA compliant plan. It was not Affordable Care Act, but it was compliant. And I was nervous about the cash price of that because I knew what the cash price was. And the cash price was about $80 or $90 a month, the way we had it set up. My wife did a tiny bit of research. I mean, not a lot. I mean, I really mean a tiny amount. She was able to find the same prescription from someone else. A 90-day supply was $7.50. So I went from $20 a month on traditional insurance to $7.50 every 90 days cash pay.
Yeah, and I had a similar experience, except I didn't even have to change pharmacies for that. I was taking a prescription that cost me $10 a month when I had my Blue Cross plan, and when I called them up randomly and said, I told them what the prescription and the dosage was. I said, how much, if I don't have insurance, how much would that be for a 90-day supply? And they said $12.99.
Wow.
So instead of $10 a month, I was paying $12.99 every 3 months.
Yeah. So I had HSA on the brain. I was waiting to share. So when you asked me that, so that's, I was a little distracted because I wanted to mention this new information a friend of mine confirmed yesterday, is that HSAs, I was hoping, would work with Christian Healthcare Ministries, and they don't. So that's something to know ahead of time if that's something you're using. So that you just want to go in fully prepared. And all of that information is on the website. It's a lot to absorb at first, so you might read it and forget about it. And so I know I had read that, but I had forgotten about it and needed to go back and check on that. So lots of little details to pay attention to, but I know that I'm happy and thankful that I'm on it. I know that you are. I've met several others who are thankful for it. So do you have anything else you want to say before we open up for questions?
Yeah, the only other thing I wanted to mention is I've been through 3 surgeries on it. My wife has given birth to 2 children on it. The surgeries, all 3 surgeries combined, I had a total out of pocket of $600, and that was for the two walking boots that I had to have. They don't cover medical equipment such as that. Well, they don't cover medical equipment that's not considered life sustaining. So they'll cover, like, for example, a pacemaker, a CPAP machine, oxygen machines, and those kind of things. But walkers, canes, wheelchairs, and that kind of such, they don't cover. But I think I'm hearing most medical insurances nowadays don't cover those anyway. I just don't know from experience. So that was the $600 out of pocket. We've had 2 children under the plan, and we haven't paid a penny out of pocket. In fact, we paid less out of pocket than my parents paid when I was born 38 years ago.
That's amazing.
Yeah. That really. So we've got it. We've got the personal experience to see that it works. The hospitals are blown away by it. When my daughter was born a couple of years ago, they kept trying to get us signed up on Medicaid. Oh, you don't have insurance? Well, we'll get you signed up on Medicaid. And I kept saying, no, I don't need Medicaid. I need a bill if you want to get paid. And they didn't know what to do with that. They were just so shocked. I said, just send me the bill and I'll get it all paid. And there was just dead silence on the phone. They didn't know what to do. So,
all right. So I think we're ready for, let's see. So we had a comment from Deacon Stephen. He was said he did something similar and it works well for him. So that's good. This MedShare approach, I don't know enough about it, but it might be a big part of the solution of fixing what's wrong with America's healthcare. And so it's not just, we didn't mention that it's not just for clergy. You don't have to be clergy to be on Christian Healthcare Ministries.
You have to be a Christian, and they don't even really define that, to be honest.
Yeah, you sign a faith statement, but if you've got, a family in your church that's struggling and they can't figure it out, this is a fraction probably of what they were paying, and can make a big difference keep them from drowning in medical debt. And a lot of people struggle with that. And so that's maybe the biggest takeaway from this is this really will keep you from drowning in medical debt.
Exactly.
And it's not hard for that to happen. Father Matthew Howell asked about the reimbursement of recurring prescriptions. So I think you talked about that. And you explained that if it's like a maintenance drug, that's not really covered, but if it's related to an incident, it is. And then could this serve, this is from Deborah, Could this serve as a hi, Deborah? And if I remember correctly, Deborah is in Melbourne, Florida. She's a friend of mine, so I really appreciate her watching. She wants to know if this could be a Medicare supplement.
Yes, they do have guidelines for that. I'm not. I'm a few years away from Medicare myself, so I haven't really spent a whole lot of time researching that. But there is a section in the book of guidelines that specifically addresses using it as a Medicare supplement.
Oh, that's nice.
I would certainly encourage you to go to the website and pull that book of guidelines and find that specific section, and they spell it all out. I think the biggest requirement is to make sure Medicare pays its portion first.
Okay.
And then Christian Healthcare would pay out. It would start after that. But again, I'd encourage you to read that since I really don't have a whole lot of expertise in that area.
Right. But you remember something being there, so that's.
There's no doubt that there's a big section on that specific subject because that question gets asked a lot.
Okay.
Yeah.
All right. I think that's it on questions. I don't see any others. I think that the information you've shared here today who knows the amount of money it could save our parishes. I mean, in a clergy family. I mean, it really could be impossible to count. Only God will know. Yeah. But this is going to this helps make sure that clergy have health insurance, that their family is covered, their children are covered, and we can make sure that the parish can afford it.
Absolutely.
All right. Thank you so much for being on today.
Absolutely. Thank you for having me.
And if you're curious about next week's episode is going to be slightly different. It's still stories that work. That's what we always talk about. I will be having on Father John Finley, who is my boss and the chairman of the Department of Missions and Evangelism. And he's going to be talking about Vespers in a couple of different ways, things that he knows has worked with Vespers. And so if you're interested in Vespers, Vespers is something that you'd like to have a little bit more information about in terms as a barometer, in terms as a test and getting started. He's going to be sharing some very interesting stories next week about how Vespers plays into the work he does and how he looks at Vespers in relationship to a parish. So I'm excited to hear what he shares next week. Next Thursday, 1 p.m. Eastern, every Thursday. So, Father Michael, thank you, and until next time.
Thank you.
All right.
All right.